So the next topic that we're going to cover in the CNA state exam review is going to be role and responsibilities of the CNA or the nursing assistant. So we're going to start by talking about ABRA. ABRA stands for Omnibus Budget Reconciliation Act. It was passed by Congress in 1987. It established many healthcare regulations. Some of those regulations require that CNAs must attend a training program. They must pass a written competency evaluation. They must pass several skills tests. Each state must maintain a CNA registry, and CNAs not working as a CNA for a period of 2 years must be retrained. Facilities must provide 12 hours of continuing education per year to the CNAs that it employs. There are role limits for nursing assistants, and we're going to talk about those role limits. You never want to give medications. You never want to insert tubes or objects into the body openings. You do not remove them from the body. You never take oral or telephone orders from the doctor. You're going to be working closely with the nurses. Never perform procedures that require sterile technique. Never tell the person or family the person's diagnosis or medical or surgical treatment plan. Never diagnose or prescribe treatments or drugs for anyone. Say, for instance, a resident says that they're having a headache, and you tell them, "Oh, it's okay. Maybe you should take some Tylenol." You never want to do that because you don't know if that resident is allergic to Tylenol. Never supervise other nursing assistants or other staff. Never ignore an order or request to do something that you cannot do or that is beyond your legal limit. There are rules for nursing assistants, and we're going to discuss those rules. You are an assistant to the nurse. A nurse assigns and supervises your work. You report information about the patient to the nurse. The nurse decides what should or should not be done for the patient. Review directions with the nurse before giving any care. Perform no functions or tasks that you are not trained to do. Perform only those functions and tasks that your job descriptions allow. And if you are unsure, you always want to check with your nurse before performing any task that you're not sure if you're allowed to do it within that particular facility or within that state. We're going to talk about your job description. A list of duties and responsibilities you will be expected to perform at your job include, um, but we're first going to talk about the things that you don't want to do or jobs that you don't want to accept and the reasons why you don't want to accept them. If a job is asking you to act beyond the legal limits of your role, if they're asking you to function beyond your training limits, or if they're asking you to perform acts that are against your moral or your religious values, these are jobs that you do not want to take. Delegations. RNs are delegating to LPNs, and LPNs can delegate tasks to a CNA. An RN or LPN can supervise a CNA. A CNA cannot delegate or supervise another CNA. There are 5 rights to delegation. We're going to go over those. The first right is the right task. You want to make sure it's the right task in your job description before you complete a nursing task. You want to make sure that you're covering the 5 rights of delegation. Is it the right circumstance given the patient's condition? Do you have the experience to perform this task? Can you perform it safely? Do you have the required equipment and do you have the supplies? And then, is it the right person? Are you the right person for this task? Do you have the necessary training to complete this task? The right directions and communications. Are the nurse's directions clear? Is the nurse present or near to help you if you have questions? The right supervisor. The RN should answer your questions about the task assigned to you. The RN should show you how to do a task that you are unfamiliar with. The CNA role in delegation. You accept a task as a CNA, and if you accept a task, you must complete the task safely. You need to ask for help if you need it. You ask questions if you are unsure of any directions, and remember that you are responsible for your actions. Refusing a task. You should refuse a task when the task is beyond the legal limits of your role. The task is not in your job description. You are not trying to perform the task. The task could harm the person. The person's condition has changed. You do not know how to use the supplies or the equipment. Directions are unethical, illegal, or against your agency policy. A nurse is not available to supervise you while you're completing the task. You never want to ignore an order or request to do something. Tell the nurse about your concerns. You cannot refuse a task because you just don't like it or you just don't want to do it. What is ethics? Ethics is the discipline concerned with what is right and what is wrong. It involves morals and making choices or judgments about what should or should not be done. An ethical person behaves and acts in an ethical way. um, Ethics for your nursing assistants. You want to respect each patient as an individual. You want to protect the patient from harm. You want to protect the patient's privacy. Be honest and trustworthy. Avoid spreading gossip. Be aware of the limits of your role and perform your job to the best of your ability. Perform no acts that is not within the legal scope of a nursing assistant. Perform no acts for which you have not been adequately prepared. Take no drugs other than the prescribed drugs given to you by your doctor. Accept responsibilities for your actions. Legal issues. A law is made by a government body such as the U.S. Congress, which is federal, or state legislation, which is state. Laws are a set of rules that are enforced by the courts. Laws protect the public welfare and are enforced by the government. So we're going to start talking about your professional conduct as a CNA. You want to respect your patient's right. You want to behave ethically. You perform your job as required. You want to follow rules and regulations, and you don't want to do anything for which you have not been trained. Let's talk about some legal aspects. A law is a rule or conduct made by a government body. Criminal law, offenses against the public and against society. A person found guilty of a crime is fined and sent to prison. In the civil law, this deals with relationships between people. A person found guilty usually has to pay a sum of money to the injured person. And then you have a tort, which is part of the civil law. It's a wrong committed against a person or their property, and it can be in laws that concern healthcare workers. Assault, a threat to do bodily harm. Attempting or threatening to touch a person's body without that person's consent is assault. Battery, the actual touching of another person's body without their consent. Hitting, pinching, or pushing a patient, forcing a patient to do something against their will. Consent can be withdrawn at any time. Patients have the right to refuse treatment. You have to remember those things. Avoid assault and battery charges by informing the patient of what you plan to do. Make sure that the patient understands. Give the patient time to respond. Report refusals of care to the nurse and document the facts. Never carry out a treatment on your own against wishes. False imprisonment is restricting or restraining a person's movement without proper consent. Patients have the right to leave the hospital without the physician's permission. A patient cannot be restrained to make him cooperate or to punish him for his behavior. Side rails are considered a restraint. As such, must be ordered by the physician in most long-term care facilities. Invasion of privacy, failing to protect the privacy of the patient's body or the privacy of their personal information. You want to knock on the door before entering a patient's room, close the door and pull the curtain before giving any care. Do not expose the person's body unnecessarily. Do not take pictures of the person without their consent and notify the person when you're exiting the room. Do not discuss the patient's treatment with anyone except the nurse supervising your work. Ask visitors to leave the room when you are giving care to the patient. Do not open the patient's mail unless they ask you to do so. Do not discuss patient information with another patient. relatives and friends of the patient, visitors of the hospital, representatives of the news media, fellow workers, except when in conference or they are a part of this patient's care, or don't discuss your patient's information with your own relatives and your own friends. This is of HIPAA, which could lead to a fine or imprisonment. Allow the patient to visit with others in privacy. The patient should be allowed to visit with his clergy or his preacher in privacy. Allow the patient to use a telephone in privacy. Negligence is failure to give proper care, which results in harm to the patient or the patient's property. You will be guilty of negligence if you fail to perform a task or perform a task in a careless manner, or you harm a patient by doing something you are not allowed to do. Other common neglectful acts when a nursing assistant has left a side rail down and the resident falls because they're thinking that that side rail is there and it's not, and they fall out of bed. This will be considered a negligent act. Ignoring the resident's call light is going to be negligent because that patient can fall trying to get to the bathroom after waiting for an ample amount of time without. Failure to place the call signal within the patient's reach can result in negligence. So you always want to make sure that you leave that call light in reach. Most patients that fall, they fall because they are making an attempt to reach the call light or exit the bed to go to the bathroom. There's some other neglectful acts like a patient is burned because a CNA applied a warm water bottle that was too hot to their skin. For example, a patient's denture breaks after being dropped by the nursing assistant. A resident complains to the CNA of chest pain and difficulty breathing. The complaints are not reported to the nurse. The patient has a heart attack and dies. The wheel on the patient's bed were not working or not locked, and the bed rolled as the patient attempted to lie down. This patient fell and they broke their leg. So all of these are examples of negligent acts. So you want to be mindful when you're providing care for the patients that you're being safe. You want to refuse the nurse's order if you are asked to do something that is beyond the legal scope of your role. You have not been prepared to perform the function safely. You know that the act or the procedure may cause harm to the person. The nurse's directions or orders are unethical, illegal, or unclear, and they could be against the policies of the facility. And you would refuse the nurse's orders if the directions are unclear or they're incomplete. Malpractice is negligence performed by a professional. Slander is making false statements about a person orally, and then libel will be making false statements about a person in print, writing, or through drawings. In the world that we're living in right now, a Facebook post can be an example of libel. You want to protect yourself from slander or libel charges by never making false statements about a patient or a resident. Theft is taking anything that does not belong to you. If you see someone stealing something and do not report it, you are guilty of aiding and abetting the crime. Tipping. Tips must be courteously refused. You are responsible for your own actions. This is called accountability. Legal actions may be brought against you if you are guilty of any action that harms a patient. It is your responsibility to know what tasks a CNA is allowed to do in your facility. Informed consent. Consent is considered informed when the person clearly understands what the doctor has explained to them, and only the physician can give informed consent. This is not something that a CNA that's within the scope of a CNA. So informed consent is obtained when the person clearly understands the reason for their treatment, what will be done, how it will be done, who will be doing it, and what's the expected outcome. People who are mentally incompetent, unconscious, sedated, or confused cannot give legal consent. A will is a statement of how a person wants property distributed after his or her death. You are not legally able to prepare a will. Legally, you can witness the signing of a will if you are not named in the will. You are advised not to witness a will if asked to do so. Refer the patient to the nurse who can contact the social service department. A living will is a document that leaves instructions about whether or not you want your life prolonged by artificial means if you become terminally ill. Guidelines for confidentiality. You never repeat information given to you in your role as a nursing assistant. You want to restrict your sharing of information to the reports of observations you give to the nurse. If anyone asks about the patients, refer all such questions to the supervisor or the nurse. Never discuss the patient or anything about the patient in the public places of the institution, such as the hallway, the elevator, or the cafeteria. You never know who's standing behind you or who's listening in their relationship to their patient. Never bring such information into discussion outside the healthcare institution. Abuse is defined as having one or more of the following elements: willful causing of injury, unreasonable confinement, intimidation, punishment, deprivation of goods or services needed for physical, mental, or psychosocial well being. The abuser is usually a family member or a person caring for the elderly individual. Physical abuse. When you handle a patient too rough, performing the wrong treatment on the patient, hit or push, pinching the patient is a form of physical abuse. Neglect to turn the patient causes circulation to be impaired. When you do not carry out proper exercise and the patient experiences pain when unused joints are finally moved. When you fail to see that the patient has no food or water, when you fail to carry out proper patient hygiene routines. All of these are examples of physical abuse. Verbal abuse may be directed toward the patient or may be expressed about the patient. You will be guilty of verbal abuse of a patient if you use profanity in dealing with the patient, raise your voice in anger at the patient, call the patient unpleasant names, or you tease the patient unkindly. Psychological abuse occurs when you make the patient fearful of you, threaten the patient with harm, threaten to tell something to others that the patient doesn't want others to know, uh, when you make fun or belittle the patient in any way. Financial abuse involves misuse of the patient's money or personal possession, and then sexual abuse can involve actual physical contact or threats of physical contact. The person may be forced to perform sexual acts out of fear of punishment or physical harm, or the person may be consenting. Whether the person is consenting or not is sexual abuse for a professional employee to have sex with a patient. Signs of abuse: physical abuse is unexplained broken bones, injuries that occur over and over, such as an injury shaped like a belt buckle, burns shaped in certain ways, like a cigarette burn or a burn caused by an iron, bite marks, unexplained weight loss, extreme dry and cracked skin, or signs of dehydration, blood in the underwear, bruising in the genital area, sexually transmitted infection. Emotional swings of abuse. Mood swings, fear and anxiety, especially when a caregiver is present, lack of appetite, flinching when a certain person is near. Other signs of abuse: missed doctor's appointments, changing doctors frequently, wearing makeup or sunglasses to hide injury, family concern that abuse is occurring. The person does not seem to be taking his pills. The caregiver does not allow anyone to be alone with the elderly person. These are signs of abuse. Iowa does not allow nursing centers to employ persons who were convicted of abuse, neglect, mistreatment of persons in any healthcare agency. Before hiring a person, the facility must check the nursing assistant's registry and perform a criminal background check. The incident, what is done if abuse is suspected? The incident must be reported at once to the administration. All claims of abuse must be investigated. The center must prevent further potential for abuse while the claims are investigated. The investigation results will be reported to the facility, the administration within 5 days of the incident. Corrective actions are taken.